we have two new people here this evening, Deborah and Giselle. All right, let's welcome them. Deborah, could you introduce yourself to us, please?
Sure. So my name is
Oh,
Deborah.
Deborah,
Hi.
camera, camera.
Oh, I do apologize. I don't have camera here on my computer right now.
Okay, okay.
So, my name is Deborah. I'm a PhD nurse here in Brazil, and today I'm here because
Are you guys hearing properly? Your sound is kind of I don't know what's happening.
um, hello, can you hear me better?
Your sound is
Hello,
not good.
it's not good. Sorry. I don't know why it doesn't work.
Okay,
Um,
speak.
I
Try and speak slowly.
okay. So my name is Deborah.
Hmm.
I'm from Brazil, and nurse actually. And
Hmm.
today I'm here because I just got a bonus lesson to try the teaching method here.
Hmm.
Um, and I think that's all. 36 years old. I'm
Hmm.
married, and I'm living in Uberaba right now. And
Where
I
do
think
you
you guys,
where do you live? Uberlaba?
Uberaba, Minas Gerais.
Minas Gerais.
Yeah.
Okay, and how long have you been a nurse?
Um, I've been a nurse over 9 years.
Wow. And very good. Any specialty area or you're just a general
Uh,
nurse
I
practitioner?
I work on primary health care.
Primary health care.
Yeah. But my PhD is about maternal mental health, and now started. I just started to work on trauma informed care for refugee women here in Brazil.
Wow. Did you say your PhD is in maternal mental health?
Yeah, sure, exactly.
Okay, so you have a friend in need indeed here. So I'm a mental health nurse also. I'm a nurse also. All
Mm-hmm.
right. We're all nurses here. I'm in mental health. That's why
Oh,
I
great.
spent, that's where I did my master's. All right.
Oh, great. Nice.
Mm. Um, so I'm Jamaican. I live in Brazil. Also, I live in Sao Paulo. And this is what I do. I teach um general English, technical English to medical groups, nurses, veterinarians, physiotherapists, biomedics, medicals, right?
Okay.
And it helps that I'm a nurse so that I can understand your needs and wants to help you. All right. So this is your experimental class.
Yeah.
You'll see how the class progresses. We ask for your participation in everything we do, read, converse, and all of that, right? Sometimes. All right.
All right. Perfect.
All right. And then we have Giselle. Guys, Giselle just did surgery, so she's recuperating. Or Giselle.
Hi, yes, I am Giselle. Today is my experimental classes here. I'm
Mhm.
an oncology nursing. I'm just do bone marrow transplant. I'm like so much to work with oncology and hematology in special. I'm just 20 years old. I'm doing this hematology.
You're in college for 20 years?
Yes, I did. It's crazy, yes, but yes, it's normal. I'm from Rio de Janeiro and I'm working in a big hospital in Rio de Janeiro too.
Okay, so you're Caroline's people. See, she's like, ooh, her face just light up. Her face just lit up. She has a
Yes,
karaoke to me. Ela é karaoke
Yes,
também.
yes, I'm carioca.
But Carol lives in Espírito Santos now. She's karaoke, but she lives in Espírito Santos.
Yes, I am. And my
Um,
all my professional time, like a nurse, and I
Mm,
start with an oncology nurse, and I'm stay with an oncology nurse. I did specialization and master degree, everything in an oncology nurse, but I enjoyed this way.
mm,
Yes, and right now we start with CAR T cell.
mm,
I'm a little nervous, but I enjoy it. I like to read about it, and this is my way. And now I don't know if I want right now to go to United States to work.
okay, I was going to ask you that very same question. What are your goals? What do you expect to do? And in working at the hospital where you're at now, do you see foreigners, people come there speaking English? Have you ever had a chance to use or to speak to people in English from your in your hospital?
Sometimes, yes, sometimes you have. Right now, we are doing a research with Virginia University
Mm.
team. This is so nice, but so difficult for us.
Why is it difficult?
It's difficult, but we live and we have one people, of course, people, organisms, everybody's equal, but our social reality is so much different.
Hmm.
It's
Hmm.
so much different.
Is it a situation of cultural difference or just basic social structure?
Yes, basic structure, and this is complicated for us, for American people to understand basic things. When
Hmm.
we take your medicament every day with water, this is
Hmm.
normal for you. With water, just drink water. But for here in Brazil, especially in Rio, we have population with a lot of social problems, and this type of water is costs a lot of money, is expensive. We
Hmm.
live so far away from the hospital. They can't
Hmm.
take a train, but they didn't have money to take Uber, maybe a taxi. This is complicated here.
Hmm.
And this
But
year,
but but as you said, the social dynamics, right?
social dynamics, yes.
Right. The social dynamics are so different. Here in Brazil, um, uh, what do you call it? Um, Healthcare is free. That is debatable, but it's free. However, in the United States, the minute you go into the hospital, the first question you're asked, do you have insurance? So isn't it more, um, in terms of the social dynamics, is it more flexible in Brazil than in the US?
Yes, I believe our social dynamic is so much different in this making
Mm-hmm.
a total cost for us. I just work with SUS, a public hospital. I enjoyed
Mm-hmm.
so much, but sometimes it's so difficult for us, for professionals.
Mm-hmm.
But they don't have sometimes money to take a bus to be in the chemotherapy doses. They just,
Mm-hmm.
I can't go, but I don't have enough money. I didn't have enough money to pay the bus.
To come to get treatment.
Yes.
Yeah.
But I enjoy this. I'm an
Yeah.
oncology nurse, and I like this oncology so much. I this year I want to go in the United States of America for the Oncology Nurse Society Congress.
Mm-hmm.
UPE, yes, in Dallas, I don't know where, Dallas or San Antonio. Maybe it's in San
San
Antonio,
San- San Antonio, Texas.
in Texas. Yeah, yes, yes, in Texas.
Okay, very good. All right, as I said before, Gisele, thank you so much for being here with us. This is your first class, experimental class. The classes are basically simple. All right, we try to get you to, most people know the terms and pronunciation, reading in Portuguese. Well, everybody do. However, what we do is that we basically try to get you to familiarize yourself with the, technicalities of, the language, how to say certain things in English. All right, get you familiarized with the vocabulary. All right, so sit back, relax, enjoy the ride, and let's see where it goes from here. All right, so as I said before, I also am a nurse. I'm a mental health nurse. I specialize in mental health. I love mental health. All right, I started out as a general practitioner nurse, and then I did my specialty in mental health. I'm really fascinated with the human mind, and that's just it. I no longer working in nursing. I'm an English teacher at the moment. All right. All right. Hi, Daisy. Hi, Brenda.
Hi, teacher.
Hello.
Hi, good evening. Good
Good,
evening.
good evening. All right. Andresa. Andresa.
Hi, teacher.
Mustakana. Mustakana.
Eu o quê?
Mustakana. Open your camera. Abre sua câmera. Diga mal a sua cara, filha. Ah, tá bom. Tá soltinha agora.
Eu vou fazer a outra cirurgia do SIS amanhã. É o meu
Ah,
fim, galera. Vou ficar uma semana muda aqui.
all right, guys. This evening, hoje, today we're going to be looking at basic dialogues. Basic dialogues. All right. So, to basic dialogues with the objective to conduct clear, polite, and professional basic dialogues with patients using appropriate nursing English for daily care, assessment, and reassurance. Very important, guys. All right. You must be clear, professional, and polite while administering daily care. Basic nurse patient dialogue occur constantly during vital signs checks, hygiene care procedures, and patient education. Clear and empathic communication improves cooperation, safety, and patient satisfaction. This is essential for bedside nursing communication, patient centered care, and for OSCE and NCLEX style interactions. All right, good. Let's start with Gisele. Lei para mim, favor. Read for me, please.
Wow. Nurse-patient basic dialogues. Nurse-patient dialogue focus on gathering information, explaining actions, and researching patients. Language must be simple, respectful, and clear, especially when patients are anxious or in pain. Professional dialogues include oh, quality requests, clear,
Polite,
polite
polite.
requests, polite requests, clear explanations, and supportive responses that encourage patience, cooperation, and trust.
Encourage patient cooperation and trust. Okay, very good. Brenda. No, Brenda. Deborah. Sorry.
Ah, tá.
Brenda, Deborah. É mesmo. Tá trocando, né? Deborah.
Hi. Oh, would you
Can
like that I'm here again?
Yeah, but your microphone, Deborah, is your microphone is really your microphone is really I'm not hearing you clear.
Hello?
Yeah, that's better.
Okay. Um, nurse-patient-based dialogues. Nurse-patient dialogues focus on gathering information, explaining actions, and reassuring patients. Language must be simple, respectful, and clear, especially when patients are anxious or in pain. Professional dialogues includes polite requests, clear explanations, and supportive responses that encourage patient cooperation and trust.
Very good. Very good. Andres,
Nurse patient basic dialogues.
dialogues.
Dialogues. Nurse patient dialogues focus on gathering information, explaining actions, and assuring patients. Language must be simple, respectful. Como é que fala?
Respectful.
Respectful and clear, especially when patients are anxious or in pain. Professional dialogues include como é que é? Polite,
Right, polite.
polite requests, clear explanation and
Explanations.
explanations, and support
Support. Supportive.
supportive responses that encourage patients' cooperation and trust.
Very good, Andresa. Andrea.
Nurse-patient dialogues focus on gathering information, explaining actions, and reassuring patients. Language must be simple, respectful, and clear, especially when patients are anxious or in pain. Professional dialogues include polite requests, clear explanations, and supportive response that encourage patient cooperation and trust.
Very good, Andrea. Giovanna.
Uh, Nurse-patient dialogues focus on gathering information, explaining actions, and reassuring patients. Language must be simple, respectful, and clear, especially when patients are anxious or in pain. Professional dialogues include polite requests, clear explanations, and supportive responses that encourage patient cooperation and trust.
Okay, very good, Giovanna. Caroline. Caroline.
Nurse-patient dialogues focus on gathering information, explaining action, and reassuring patients. Language must be respectful and clear, especially when patients are anxious or in pain. Professional dialogues include polite requests, clear explanation, and supportive responses that encourage patient cooperation and trust.
Very good. Brenda.
So, nurse-patient dialogue focus on gathering information,
Gathering. Gathering.
Okay, gathering information, explaining actions, and reassuring patients. And the language must be simple and respectful and clear, especially when patients are anxious or in pain. And the professional dialogues include right?
Includes
And polite requests, clear expectations,
polite,
and polite requests, clear explanation, and supportive responses that encourage patient cooperation and trust. Explanations.
explanations. I didn't hear the S, plural.
Okay.
Very good, very good. Uh, Marcel,
Hi.
I,
Okay. Nurse patient dialogues is
dialogues,
dialogues. Focus on gathering
gathering, very good.
information, explain actions, and
Actions,
uh,
actions,
actions and reassuring is reassuring.
reassuring,
Uh,
reassuring.
reassuring.
Mhm.
Patient language must be simple,
Simple,
respectful, respectful ways,
respectful,
respectful, and clean, especially when
especially,
patient, uh,
especially, especially
especially when patients are anxious,
anxious.
anxious or in pain. Professional dialogue,
Professional dialogues,
professional dialogue include polite request,
polite,
polite request, clear explanation is
clear explanations,
clear explanation and supportive response that and encouraging is
and
encouraging
encourage
encourage patient cooperation and
co-
trust.
cooperation
Cooperation and trust.
and trust. Very good, Marcel. Very good. Daisy,
Hello,
hello.
nurse-patient dialogues focus on gathering information,
Gathering, gathering,
gathering information, explaining action,
explaining,
explaining action, and
action,
act,
action.
action, action, and reassuring patients. Lang-
Re, and, comma,
ah,
reassuring,
reassuring,
reassuring.
reassuring
Isso.
patient. Language, né?
Language,
Language must be simple, respectful, and clear, especially
actually,
when patients are anxious.
anxious, anxious,
Como teacher, repete aí.
anxious, anxious.
Anxious, on in pain. Professional dialogues include, include polite requests, clear explain, explanation, explanations, and supportive
Okay.
responses that encourage
En-
patient, accru- encourage,
Encourage
encourage patient cooperation and trust.
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 Very good, Daisy. Very good, Marcel. Very good, guys. All right, nurse patient basic dialogues. Nurse patient dialogues focus on gathering information, explaining actions, and reassuring patients. Language must be simple, respectful, and clear, especially when patients are anxious or in pain. Professional dialogues include polite requests, clear explanations, and supportive responses that encourage patient cooperation and trust. Very important. All right. Okay. Angelica, Caroline, Brenda, Marceli, Daisy, Andrea, Giovanna, uh, Deborah, then just Ellie. Again, oops, Daisy went to the top. All right. Daisy, Marceli, Brenda, Caroline, Giovanna, Andrea, Angelita, Deborah, Gisele. Start. Daisy.
How are you feeling today? Open question. Initial assessment. Assessment.
Initial assessment. Perfect.
Initial.
Marceli.
I'm going to check your, né?
Mhm.
You.
Your
Check your vital sim.
vital signs.
Eita, vai então sai.
Again, Genova, vital
Vital
signs.
signs.
Isso.
Ok, vital signs.
Mhm.
Explanation before producers.
Procedures.
Hã?
Procedures.
Misericórdia. Procedures.
Before procedures.
Before procedures.
Very good. Brenda.
Um, could you please polite request and patient cooperation.
Cooperation. Very good. Carol.
Let me know if you feel uncomfortable. Reassurance during care.
Reassurance.
Reassurance.
Isso. Giovanna.
This may take a few minutes. Time explanation, reducing anxiety.
Andrea.
Are you in pain right now? Symptom check, ongoing assessment.
Andresa.
Everything is going well. Reassurance, reassurance,
Re- reassurance.
reassurance, patient comfort.
Patient comfort. Deborah.
Do you have any questions? Clarification, patient education.
Very good. Number one, Gisele. Taslima, there,
Okay. How are you feeling today? Open question, initial assessment.
assessment. Perfect. All right. So, guys, pay attention to the vocabulary. Pay attention to the vocabulary and its meanings because we're going to do the activity now. How are you feeling today? I'm going to check your vital signs. Could you please, polite request, let me know if you're feeling, if you feel any, if you feel uncomfortable. They may take a few minutes. Are you in pain right now? Everything is going well. Do you have any questions? Those are the vocabulary. Gisele, match the phrase to its function. Match the
One.
phrase to its function. Number one.
Could you please lay down?
I'm sorry.
Could you please lie down?
Could you please lie down?
Polite request.
Very good. Uh, Andrea, number two.
How are you feeling today? Open question.
Very good. Giovanna, number three.
Uh, this will only take a moment. Explanation.
That is correct. And the final one is Carol.
Let me know if you feel pain. Polite request.
Very good. You guys are the best. All right. So the answers are A, 1C, 2B, 3D, 4A. All right. Okay. Now, functional language, polite request, offers, and reassurance. Common structures deals with polite requests. Could you, can you, would you mind? Offers, I can help you with. Reassurance, it's normal to feel that you're going well. Examples. Angela, is there read the examples for me, please?
Could you please sit up?
Again, Genova,
Could you please sit up?
could you please sit up?
Could you please sit up?
Very good, Próxima.
Ah, é todas. I
Alan?
can assist you with walking. Walking?
Walking,
Walk,
walking.
walking. It's normal to feel a little discomfort.
It's normal to feel a little discomfort. All right. So we use functional language, polite request, offers, and reassurance. All right. We need to reassure our patients. All right. It's going to be okay. I'm going to take care of you. All right. Okay. Any questions? No? Sit down, tell me if it hurts. I will help you walk. Don't worry. All right. So, what I want you to do, rewrite the sentences using polite, professional language. Rewrite the sentences using polite, professional language. 5 minutes, 5 minutes. Rewrite the sentences. Rewrite the sentences. Suppose someone on the chat. Man on the chat. Sim. Não, man on the chat.
Ô, teacher, eu não entendi, não. É pra fazer o quê?
Oi?
É pra fazer o quê?
Oh, wait.
Daisy, é para reescrever as frases usando formas educadas ou também a linguagem profissional. Então, ao invés de falar só sit down e mandar a pessoa sentar, é para deixar mais educado.
Uhum.
Ah, entendi, obrigada.
Please play. Down. And we put lay. What is it? It's very simple, simple, easy. You can send to WhatsApp, okay?
Teacher, I think she don't have your number. Because of that, she answering chat.
Let's see. Number 3. Number 3. Carol,
Hey,
were you were saying number 3 doesn't have an answer?
no, I just saying maybe Giselle and the Deborah don't have your number, so they answering in chat.
Chat. Okay, okay, no problem, no problem, no problem. Could you tell me if it's in your arm hurts? Okay, if you feel. No, Andrea, so computador está autocorrect. É só letrar errado. Você vê? André,
Diga.
seu computador está fazendo errado da frase. Você só letrou errado. Aqui, você coloca, tell me if you feel pain. I will help you with your back. Okay? Don't worry, everything. Okay, that's it. That's it. That's it. That's it.
É que eu não consegui colocar uma frase embaixo da outra.
Ah, tá. Google Meet não permite. Tum, 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 tum. I'll let you walk around. Please sit down here in that placenta. Gisele, explica para mim como se usa placenta.
Como, please?
Você escreve, please sit here in that placenta.
Ah, excuse me, this place.
In this place, in that place, in this place. Example. Um, please sit down slowly. That's right. How do you sit down? How do you sit down? Um, Daisy, have you sit down? No. Do you want? Você quer apresentar?
Ah, entendi, teacher.
Do
Ok.
you want to sit down?
Acho que a segunda eu errei também, pelo que eu tô vendo aqui.
Marcella, please sit down slowly. Please let me know if you are feeling any pain so I can give you some medication. Very good, Marcella. Brenda, could you sit down, please? Tell me if it hurts, please. I will help you walk. Don't worry. Don't worry, it's normal. Very good. Could you tell me if it
Teacher.
hurt? Very good, Brenda. Could you tell me if it in here? I said if it in. Could you tell me? It in. No. Yeah. Please sit down. Please let me know if any discomfort. I'll assist you to right. Don't worry. You won't. All right. So basically, everybody has an idea. Yeah, very good ideas. Very, very good responses. Okay. 1 second. Could you please sit down? Please let me know if it hurts. I can help you walk. There is no need to worry. All right. Here's that. Patient satisfaction scores are strongly linked to how clearly and emphatically nurses communicate during routine interactions, not only during complex procedures. Again, did you know Patient satisfaction scores are strongly linked to how clearly and emphatically nurses communicate during routine interactions, not only during complex procedures. All right. Uh, Brenda
Hi, teacher.
Daisy.
Okay,
Let's go.
okay.
Start. Brenda.
And good morning. How are you feeling today?
I'm a bit tired.
And I am going to check your vital signs now.
Okay.
And could you please roll onto teacher?
Onto your side.
Yes, onto your side.
Suri.
Sure.
Okay.
Sure.
Um, let me know if you feel uncomfortable. Uncomfortable.
Uncomfortable. Comfort.
Okay,
Easy.
uncomfortable. Okay.
Easy.
It's fine.
And this will only take a few minutes.
Thank you.
Thank
Very
you.
good. Very good. You're welcome. Thank you. Very good. Uh, Deborah Andre. Start.
Good morning. How are you feeling today?
Andrea.
I'm a bit.
I'm going to check your vital signs now.
Okay.
Could you please roll onto your side?
Sure.
Let me know if you feel uncomfortable.
It's fine.
This will only take a few minutes.
Thank you.
Very good. Very good. Carol Giovanna.
Me as a nurse.
Start. Anybody can start.
Okay. Good morning. How are you feeling today?
I'm a bit tired.
I'm going to check your vital signs now.
Okay.
Could you please roll onto your side?
Sure.
Let me know if you feel uncomfortable.
It's fine.
This will only take a few minutes.
Thank you.
Yeah. Very good. Andresa. Marceli. Where's
Oi.
where's Gisele? Gisele saiu.
Primeiro é eu ou Andressa?
Andresa, começa.
Ok.
Good morning. How are you feeling today?
I'm a bit tired.
Tired, cansada.
I'm a bit tired.
I'm going to check your vital signs now.
Ok.
Could you please hold onto your side?
É sorry, é que fala?
Sure.
Sure.
No, sore, no, sure. Sure,
Sure is?
sure.
Let me know if you feel uncomfortable.
It's fine.
This will only take a few minutes.
Thank you.
Thank you.
Very good. Very good.
Gente, deixa eu falar um negócio que eu tô aqui segurando. Eu achei a voz da Débora. É tipo assim, eu nunca vi a Débora falando, né? Eu achei a voz da Débora daquelas mulheres que faz telemarketing. Eu amei.
Não sei se eu agradeço. choro.
Cara, é muito bonito, é real, oficial.
Thank you.
A Andressa parecendo uma fã. Ai, eu adorei a voz dela. É a voz dela.
Velho, eu achei muito massa, eu fiquei ouvindo assim, meu Deus, parece muito. Eu não seguro a minha língua. Sorry.
Andrea é da pessoa verdade. No, she's not real. Andres is not real.
Eu não ia dormir de noite se eu não falasse.
All right. Carol. Good morning. How are you feeling today, Carol?
I am a bit tired.
Oh, no problem. All right. So I'm going to check your vital signs now, okay?
Okay.
All right. So could you roll over onto your side for me, please?
Sure.
Now, let me know if you feel uncomfortable.
It's fine.
And injection. This will only take a few minutes.
Thank you.
Very good, Carol. Very good. Andrea. Good morning, Andrea. How are you feeling today?
I am a bit tired.
Really? Sorry to hear that. No problem. I'm going to check your vital signs now, okay?
Okay.
All right. So, Andrea, could you roll onto your side for me, please?
Yeah, sure.
Just let me know if you feel uncomfortable, okay?
It's fine.
All right. And this will only take a few minutes, all right?
Okay, thank you.
You're welcome, Andrea. All right. Okay, guys. Very good. Very, very, very good. Any questions?
No.
No, sir. Andrea. Andresa.
Eu o quê? Eu o quê?
Andresa, me deixa, por favor, filha. Deborah,
Hi.
how was your experimental class?
Was great. I really enjoy it, the classes, and I really enjoy my classmates too.
Oh, essa cara tá gordinha.
Eu tô encantada, velho.
Meu Deus do céu. A Andressa, como é que ela tá?
Essa gordinha.